Hello and welcome to the Breath of Hope's post-treatment physical activity program brought to you by Fluid Health and Fitness and Survival to Strength. This program is focused on rebuilding strength and stamina and restoring your body's natural function. Before starting your workout program, please receive medical clearance before you begin any activity. This program is a scientifically based approach to stability training and daily activity training for lung cancer patients. This is going to promote recovery and well-being after receiving treatment. It's made up of 3 sections: a warm-up, a main workout, and a cool-down. You'll have 3 options for each exercise offered that meets you at your level of function. The equipment you'll need for the program is a chair, a light exercise band, something heavy like a book, a mat, and lots of water. Please feel free to pause the video or rewind it to get properly set up for each movement. Now, let's get started with the warm-up portion of this program. Today's warm-up is a sit-to-stand diaphragmatic breath drill. Starting with the reduced option, perform a sit-to-stand diaphragmatic breathing with pursed lips from a seated position. Begin seated in a chair with your feet flat on the floor. As you inhale deeply through your nose, rise slowly with a standing position. Exhale through your pursed lips as you sit back down. This controlled movement engages your diaphragm, helping to open up the lungs and enhance breathing efficiency. Take your time, pausing between each sit to stand if needed. For the base option, perform a sit to stand with dual arm overhead reach. Start seated, and as you inhale, rise to stand and reach both arms overhead. Exhale through pursed lips as you lower your arms and return to the seated position. The dual arm overhead reach adds a gentle stretch through the torso, supporting lung expansion and enhancing core and leg strength. Focus on smooth, controlled breathing as you move. In the advanced option, move into an iso squat with alternating step back to overhead reach. Start in a squat position, hovering just above what would be the height of a chair. Inhale as you step on one foot backward, reaching the same side arm overhead. Then return to the squat position and exhale through pursed lips as you lower. Alternating sides with each breath cycle, maintaining balance and core stability. This variation provides a deeper challenge for coordination, core engagement, and controlled breathing. This sit-to-stand diaphragmatic breathing drill is designed to enhance oxygen flow, improve lung capacity, and support physical strength and recovery. By combining breathing with gentle movement, you're helping increase both respiratory and muscular endurance, which is especially valuable during treatment. Now let's look at the benefits of the sit-to-stand breathing drill, which prepares your body for movement and improves core stability. As you move from sitting to standing at your breathing pace, this warm-up helps restore natural diaphragm breathing and promotes dynamic spinal stability, strengthening your back. By encouraging deeper, steady breaths, it reduces stiffness and fatigue, making it easier to breathe and move. This breathing drill also supports lung health by helping clear secretions, keeping your lungs functioning well. Some of the benefits for the drill include a stronger diaphragm, improved spinal stability, and reduced stiffness, helping you breathe and move with greater comfort and ease.
You just completed the first exercise of the post-treatment program, the alternating march. You did 2 sets of this exercise. Each set was 2 minutes. The reason to add this exercise was to help strengthen your lower back and hip muscles. Now, let's move on to the next exercise.
Our next exercise is the alternating march bridge. For the reduced option, start with the seated alternating march. Begin seated with your feet flat on the floor and place an exercise band around your thighs. Alternate lifting each knee, engaging your core with each lift. This variation offers a gentle way to activate the hips and core while remaining seated. If the band feels too intense, try without it or reduce the number of repetitions to keep the movements comfortable. For the base option, move to a supine isometric bridge with alternating march. Lie on your back with your knees bent, feet shoulder width apart, and the exercise band still around your thighs. Lift your hips into a bridge position, holding steady and alternating, lifting each leg while maintaining the bridge. This version increases core and glute engagement and provides a mild challenge for stability. Focus on slow, controlled movements to keep proper form and avoid straining your back. For the advanced option, progress to an all-4 position with alternating hip extension. Begin on hands and knees with the exercise band around your thighs. Extend one leg back against the band's resistance, then alternate sides. This movement deepens the challenge by activating the glutes, core, and lower back, enhancing overall stability and strength. The alternating march bridge offers numerous benefits for post-treatment lung cancer patients. Strengthening the core and glutes can improve stability, reduce strain on the lower back, and help restore mobility and posture, supporting ease and comfort in daily movements. This exercise plays an important role in building dynamic stability, especially for post-treatment recovery. By targeting the psoas, the key muscle group connecting your lower back and hips, this movement helps improve strength, balance, and endurance. Strengthening this area provides a solid foundation for your core, supporting better posture and reducing physical fatigue that can come after treatment. Improved stability in the psoas also makes it easier to transition from sitting or lying to a standing position, a common challenge for many in post-treatment recovery. This exercise not only strengthens the psoas and core muscles, but also enhances stability, balance, and control. For the post-treatment group, this is crucial as these movements provide the foundational strength necessary for more advanced physical activities. Strengthening the lower back and hips contributes to better posture, helping relieve strain in the other areas of the body, such as the neck and shoulders, that may be overcompensating for weak core muscles. Additionally, reducing fatigue with this kind of targeted exercise can boost energy levels throughout the day, making it easier to maintain daily activities or tasks with confidence and control. For those in post-treatment recovery, it's also important to listen to your body. If you experience any discomfort in the lower back or hip flexors, try using a lighter resistance band or opt for a simpler version to prevent overtaxation. Remember, the goal is to build strength gradually, and overstressing muscles can lead to unnecessary strain, especially when your body is already in recovery.
You just completed the first exercise of the post-treatment program, the alternating march. You did 2 sets of this exercise. Each set was 2 minutes. The reason to add this exercise was to help strengthen your lower back and hip muscles. Now, let's move on to the next exercise.
Our next movement is a back extension with shoulder flexion. For the reduced option, begin seated with the exercise band anchored under your feet. Sit tall, pull one arm back in a rowing motion while retracting your shoulder, then switch to the other side. This controlled alternating movement strengthens the upper back and shoulders from a stable seated position, reducing strain while promoting gentle muscle engagement. If the resistance feels too strong, try using a lighter band or perform the movement without it. For the base option, stand up without the band. Start each movement by retracting your shoulders back, then lift both arms forward into a shoulder flexion, engaging your upper back and shoulder muscles. This variation focuses on maintaining shoulder stability and control, supporting good posture and upper body strength without added resistance. Move slowly, ensuring your shoulders are stable before lifting your arms. For the advanced option, stand with the band anchored at the opposite hip. Hold the band with one hand, pulling back into a W shape with the working arm, retracting the shoulder, then switch to the other side. This version challenges your balance and core stability while strengthening the back and shoulders, as the crossbody resistance encourages deeper engagement through your torso. Alternating sides also adds a dynamic element, promoting coordination and postural control. These back extension exercises offer several benefits that are particularly valuable for lung cancer survivors. Strengthening the upper back and shoulders helps improve posture, which can support deeper, easier breathing by allowing the chest to open up more fully. Improving posture also reduces strain on the neck and upper back, areas that can often feel tense after treatment. These exercises enhances functional stability, which is essential for performing daily activities with ease. This exercise is designed to enhance thoracic mobility and promote better shoulder alignment, encouraging your shoulders to stay back instead of rolling forward. Improved thoracic mobility also helps relieve stress and tension in your neck and shoulders, which can often lead to reduced headaches. Additionally, for those recovering from surgery or injury, this movement helps prevent tension and pain that can arise from scarring by gently mobilizing the upper back. So remember, the exercise improves thoracic mobility and promotes a more open chest and aligned shoulders. It reduces neck tension and helps to alleviate headaches. For post-treatment individuals, maintaining mobility in the upper back is essential, as this prevents tension and discomfort associated with scarring, allowing for smoother, pain-free movement. If you feel any discomfort in your shoulders or upper back while rotating, try reducing the range of motion or switch to a lighter band. This helps you stay in control and avoid overexertion, especially important when working on mobility after treatment.
You just finished 2 sets of the trunk extension and rotation exercise, which were 2 minutes in length. The focus of this exercise was to have smooth and controlled movements, improving the extension and rotations of your upper back. Focusing on smooth and controlled movements improves your posture and helps to open up your chest.
Our next movement is the step to balance with foot dome. For the reduced option, start with both feet flat on the ground using a chair for support. Lift one leg while using the arm on the same side to help you balance. Keep the toes of your stance foot flexed gently towards your heel, creating a dome shape in the arch of the foot. This doming stabilizes your foot and ankle. Alternate legs, moving slowly to keep control. For the base option, try alternating steps to balance without the chair. Step one leg back while lifting the arm on the same side overhead. Keep the toes of your front stance leg flexed towards the heel to form a dome shape in the arch, stabilizing the foot. Alternate sides, focusing on balance as you move smoothly through each step. For the advanced option, perform alternating single leg squats with foot doming. Balance on one leg, creating a dome in your stance foot by flexing the toes towards the heel and do a shallow squat. Then switch sides, keeping control and focusing on the doming action to stabilize your foot and ankle. This level challenges your balance, coordination, and leg strength. The exercises strengthen the feet and improve balance, making standing and walking easier and reduces the risks of falls. By stabilizing the foot and ankle, they also support better posture, which can help with breathing and overall movement. If your feet cramp, take a break until the cramp subsides, and then resume gently. Over time, your feet will adjust. If you feel any discomfort in your ankles or knees, start with the reduced option or keep your squat shallow to avoid strain. This movement not only strengthens the intrinsic small muscles of the feet, but also supports better upper back and spinal mobility. Engaging these small foot muscles helps to promote a strong foundation, which positively impacts balance, posture, and overall body alignment. Additionally, getting your heart rate up, even briefly, helps to stimulate circulation, supporting your body's natural healing process post-treatment and boost your immune function to fight infection. This exercise targets the arch of your feet, helping to build stability and support for your entire kinetic chain, from your feet all the way up to your head. This stability is essential for improved balance and helps distribute forces evenly across all your joints, reducing the risk of strain. Enhanced spinal mobility also contributes to better posture, allowing for easier and more comfortable movement. These benefits make a real difference in post-treatment recovery, where stability, strength, and resilience are key to supporting daily activities and overall wellness. If you're experiencing any discomfort or strain in your feet or ankles, reduce the range of motion and focus on a smaller, controlled doming action. Keeping movements gentle and within your comfort range helps prevent unnecessary strain, especially during recovery. Consider using a seated position to maintain control while gradually building strength in the feet and spine.
Congratulations. You finished the last set of the last exercise of the post-treatment program. Way to go! You just did 2 sets of the alternating foot doming, with each set lasting 2 minutes each. The goal behind this exercise is to improve your mobility and help improve the strength of your spine. Let's move on to some stretching for a cool down.
The next stretch is a chest and neck stretch using a strain counter-strain method. This approach combines gentle muscle activation with stretching to release tension and improve relaxation. For the reduced option, start the chest and neck stretch in a seated position. Sit with your feet flat on the floor, hands pressed together in front of your chest. Begin by pressing gently your hands together to activate your chest muscles. Then, as you release the pressure, arch your back, lift your chest, and extend your neck and shoulders. Next, round your back and tuck your chin towards your chest. This alternating pattern of activation and release stretches the chest and the neck while promoting relaxation. If needed, keep the movement small for comfort. For the base option, shift to a standing position. Stand with your feet hip-width apart and press your hands together in front of your chest to engage the chest muscles. Release your hands as you arch your back, lifting your chest and extending through your neck. Then round your back, bringing your chin down towards your chest. This standing variation allows for a greater stretch through the upper body and helps improve flexibility and posture. Finally, for the advanced option, add a resistance band to the standing position. Hold the band in front of you. Begin by pressing your hands together to activate the chest. Then release and pull the band apart as you arch your back and lift your chest, extending through the neck for a stretch. As you round your back and tuck your chin, release the band in front of the chest. This added resistance helps to activate and stretch your shoulders, chest, and neck, enhancing flexibility and upper body strength. Our last exercise is the hip flexor stretch with overhead reach. For the reduce option, start with the hip flexor stretch from a seated position with the same side overhead reach. Begin by sitting tall, keeping one foot grounded, and extend the opposite leg behind you, focusing on stretching that side's hip flexor. Reach overhead with the same arm on the same side, extending as far as you can comfortably. Alternate sides, moving gently to help release tension in the hips and upper body. If reaching overhead feels challenging, simply reach as far as feels comfortable. For the base option, move into a split stance position for a deeper hip flexor stretch. Step one leg back and press the hips forward, slightly to stretch the hip flexor on the back leg. Reach overhead with one arm on the same side of the leg that's stepping back, extending upward to deepen the stretch. This version opens the hips and lengthens the torso, helping to improve posture and breathing. For the advanced option, add trunk rotation to the split stance stretch. Step one leg back into the split stance, reach overhead with the same side, and gently rotate your torso towards the back leg. This adds a stretch through the whole side of the body and encourages deeper core engagement, promoting flexibility and coordination. Alternating sides to balance the stretch across the body. These hip flexor stretches with mindful overhead reaches can help release tight muscles, improve posture, and encourage deeper, easier breathing. Relaxing the hip flexors and upper body can reduce tension and improve overall mobility, which aids in physical recovery. The focus on gentle stretching and mindful movement supports mental relaxation, helping to alleviate anxiety, bringing a sense of calm.
Awesome job. You finished 2 sets of stretches lasting 2 minutes per stretch. Hopefully, you are feeling loose. The purpose behind these stretches is to help you relax your muscles after doing exercises on them during the workout portion of this program.
Congratulations on completing your journey through a Breath of Hope's post-treatment physical activity program brought to you by Fluid Health and Fitness and Survival to Strength. The purpose of the workout program was to help you regain strength and endurance and physical overall fitness that may have been lost during treatment. The program aims to enhance your body's function and improve your outcomes long-term. Complete the post-treatment program 2 times per week to gain the best results. Make sure to give yourself 2 days of recovery between each workout session. After a few weeks of completing the program, everyday activities will become easier and less tiring. Thanks again for joining us, and we hope to see you again soon.